Hello, everyone. It is an honor for me to be a part of the IN talk show where I would be talking to one of the legends in neurology. I would like to welcome Professor Kameshwar Prasad, who is currently the director of Rajendra Institute of Medical Sciences in Ranchi, and he has been my teacher and mentor at AIIMS New Delhi. So, hello, sir.
Hello, how are you?
I'm good, sir. So we will start this talk, and the target audience is, of course, our young neurologists who would take inspiration from your life and your work. And you have been motivating a lot of people and students across the country and even outside. And therefore, I think it is worthwhile, and it's a very good effort from IIN for these legends to be sharing their experience so that the young neurologists can also benefit from the trajectories, the experiences which you all had. So I think we can start with the what motivated you to join this neurology?
Right, good question. So I must welcome everyone who is watching this. Thank you for and thank IN for this effort. Main reason why I joined neurology was, I think, during my posting when I was doing MD medicine in AIIMS, I found neurology as most, you can say, organized and to some extent very mathematical approach to diagnosis. That was not as much in other departments. So that very logical approach, which starts from where is the lesion, what is the lesion, and how can you arrive at diagnosis and then plan treatment. All of this appeared much closer to mathematics than any other, super specialty in medicine. And also, I was quite impressed by the approach which our teachers used to take. And I thought that that is something which I love, and that is why I joined neurology. So I must say that I could have joined cardiology or pulmonary medicine, but I chose to join neurology.
Okay, so that was very insightful. Let's go back to your journey during your childhood. How were your childhood experiences instrumental, or how did they shape up your journey to this place?
Right. So remembering childhood is, it is something which we all cherish. But three things I want to tell the young neurologist. One is that I studied for up to class 10th. What is 10th now? It used to be 11th that time, in a village school. So, and it was Hindi medium school to the extent that up to class 5th, you don't even learn ABCD. It is all Hindi. So learning whatever you learn in your childhood, in your mother tongue is, I think, quite helpful, and you can start learning English anytime. And when I was giving lecture in Oxford and wrote a book in English, you can imagine that learning in Hindi medium is not in any case an impediment, and one can achieve whatever one wants. That is one point. The second point is that the teachers who are those days teaching in middle school or high school in villages, they were truly teacher in the sense that they used to inspire students and also push them to take up new challenges. So I would say my Hindi teacher, for example, or Sanskrit teacher, having seen that I can finish the course maybe within few months, they used to give me books which used to be epics. Like my Sanskrit teacher used to give me Kadambari Charitam, Meghdootam, and Avigyan Sakuntalam, all these things to read just to inspire me to go deeper and deeper into whatever subject one takes. So similarly, Hindi teacher, perhaps people don't know, gave me Krishnayan of Dwarka Prasad Mesre and many other epics which I really cherished, and that shaped my career. Those teachers tried to take you to something outside the course, but that was for inspiring and encouraging to go beyond what is within the curriculum. So that I think was very helpful. And the third thing I would say is that even though we had teachers who were, let's say, not as much qualified as they might be these days, but they were very dedicated. They loved their students. That is what inspired, I think, not only me, but many of my generation to take up studies very seriously. And also they inculcated certain values which you cherish or which you keep in your whole life, particularly regarding honesty, integrity, dedication, service to people. All of these things one learns during childhood.
So I think, sir, it would be very encouraging for, especially we get a lot of heterogeneous background of students, and some people usually lose confidence because they're not comfortable with the English language. I think you are an inspiration for many of the students at my time also, who were unconfident or used to feel very nervous while narrating histories in English, where their medium of education would have been otherwise in some other language. But nevertheless, I think the will to learn is most important, and I think the values inculcated by teachers is something which goes a long way, and it was very much evident in your discipline and the ethics of work which you have told us all along. So getting back from the childhood and moving forward to how was your college, like, you know, after 12th? Usually the students now, either if they want to become doctors, they prepare for NEET, and if they want to become engineers, they prepare for JE. What was it like in your times, and how did you decide what to do?
Right. In our time, we could have biology and mathematics both. Not in every college, but I was in St. Xavier's College, Ranchi, and there we had a choice to keep both mathematics and biology. And even though I was very keen and very interested in mathematics, my brother and parents said, take biology as well. You don't know whether you will join medicine or engineering. And it so happened that if I remember correctly, I got the highest marks in mathematics in the university and joined IIT Kharagpur. So it was in July 1972, and even completed mid-semester exam. For one semester was about to complete. And in November, this medical entrance test, where I appeared only for Bihar State Medical Entrance, that result came and I got selected. A big confusion whether to continue in IIT or join medicine. But what I did was I went to my principal of St. Xavier's College and I asked him, what should I do? I'm in IIT, but I am also selected in medical entrance. So he asked me a question. You think yourself, do you remember any engineer? And do you remember any doctor having crossed in your life? And between the two, whom do you think you will like to be, right? So one engineer I remember was from my village, and one doctor who had treated my father in my district town. So in my own mind, I compared the both. And to tell you the truth, I thought the doctor was doing a great job, and he did a great job. And so I told my principal, I am more impressed by the doctor. So he said, then forget about IIT. Even though IIT is a national and a great institution, it won't make you doctor. So I can see that you want to become a doctor. You better leave IIT and join Rajendra Medical College and Hospital in Ranchi. That is the only test I had given. I didn't go for AIIMS entrance. I couldn't go to BHU entrance because I know I remember there was communal rights at that time. So my parents said, no need to go to Banaras. And so I continued in Ranchi. But I must say that it was a big setback in the sense that from a national level institute coming to state level institute, it was, I thought, a bit worrisome for me, because I thought, why did I leave IIT and come to state level institution? But then very first month, I decided that I will do MD from All India Institute of Medical Sciences. So it happened that my target was set right from the first month of MBBS. And it was a surprise for me that in the first attempt, when I was saying that I'm going to just gain some experience in how the entrance exam is in AIIMS, I got selected. So I fulfilled my dream of joining MD medicine in AIIMS, though I was also selected for MD medicine in PGI in the same year. So within a week or 10 days, I had both the results. So I joined AIIMS New Delhi. That was my aim set in the very first month of MBBS.
Okay, sir. Any specific memories from your MBBS days? Because I do have some pictures from your graduation, and I would like to share that, and maybe you can narrate something which you remember from your MBBS. Can I do that, sir?
Yes. Please feel free to do that. I must tell you that I started using glasses in my third year, and people said, because we have to study more, and in medicine, of course, one has to study more. So probably we develop a little bit of myopia and we have to use glasses. But before that, I didn't use glasses. One thing I should say is that I was, in a sense, lucky that all my friends in medical college, they were all like-minded to the extent that not only they were all focused in studies, but they were also all teetotaler. So when I go abroad and people say, "Oh God, you haven't tasted alcohol," I blame my friends in medical college, because none of them actually either smoked or took alcohol. So we all grew together as if that is the best lifestyle. So that is one thing which I will like to share. The second thing I will like to share is that our teachers in medical college also are excellent teachers. Again, they will often call me to their residence, give me books of postgraduates, and inspire me to read, because they will often say that we can see that you have already completed your undergraduate course. So why don't you read, for example, Walter and Israel pathology? Why don't you use Anderson pathology? Why don't you read Sheila Surlock's diseases of the liver? Then they used to give brain's diseases of the nervous system. So all books which postgraduates read, they were often handed over to me to read by my teachers. So that is what made me go a little further. And I think that helped me to succeed also in AIIMS entrance test in the first go. So very good teachers. Again, nowadays, we don't find there so many teachers calling students to their residence and giving books to read, because that culture is probably gradually disappearing, but very good teachers, they take their students one step further. And I think that is something which I was very lucky to have.
Yes, so that is very good, because right now we are inundated with knowledge, and books have become online, literature has become online, so it becomes very difficult to select which one is relevant and good. And there I think teachers have a big role to say that amongst this sea of knowledge, which one should you pick up and read. Sir, I think I have a few more pictures of your MBBS days, and maybe I can go back to this. And maybe you can share one or two of your pictures about which I don't think I have.
I should tell you that our batch was a bit, maybe every batch thinks this way, but our batch was unique in the sense that we were a very cohesive group and very enthusiastic also. So we used to go for picnics together, and also our cultural society was invigorated because of enthusiasm of my batchmates. And that is the time I think perhaps for the first time there was competition in debates, competition in singing, competition in acting, mono acting. So all sorts of extracurricular activities. Our batch was very, I think, enthusiastically participating.
So for people who have not been able to recognize where is sir in this picture, I think this is your photograph, right?
Yes, 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 that's right. That's right.
And what was this trophy for, if you remember?
No, I remember all the friends. We have a WhatsApp group. We are
Nahi, yeah, but the trophy, sir?
This trophy was, I think, we had won this tug of war.
Okay.
Tug of war against another batch, and
Okay.
the whole class was really united and worked very hard to win this. And that is, I think, we are sharing together. So it was really full effort from the whole class. But that is when I also participated in a lot of extracurricular. I remember I got first prize in mono acting, second prize in Hindi debate, and third prize in, I think it was English debate. So something like that. 3 prizes I got in the extracurricular when our batch was organizing this.
So I think I have one more photograph of your college day. I think it's from 1972, if I'm correct. The date is wrong, probably. So
yeah, it is, I think 73, 74.
Okay.
I can see our principal, Dr. Mitra, sitting in the center, and all our teachers of anatomy, physiology. I think it is end of second year. So you may not recognize me. I'm in the last row. I think third from the left.
Okay.
So obviously,
I don't think any we will be recognized. I mean, you would be familiar, but it's difficult to recognize. Yeah.
Yes, that's right. So in any case, once again, I really paid tribute to my teachers, particularly. So this was after, I think, second year. It used to be second year, means finishing anatomy, physiology, biochemistry. We were also sitting together and having a photograph of the batch.
So, sir, what was your experience in MD medicine at AIIMS, and how did it, motivate you to join neurology here? You've told a bit about it, but was there any specific anecdote or story which made your decision really firm that this is what your trajectory is going to be?
No, one anecdote I will share with you. First day of my neurology, obviously it was first day, so I didn't have any case with me, and I didn't find anybody in the ward. So I thought, how am I going to spend my time? So I decided to go to the bedside of the patient who was admitted last night and start taking history. So I took history, And I had no time to examine. And in the meantime, Professor Ahuja came with some more residents. And so when he reached the bedside, he said, "Who will present the history?" So my senior resident was missing from there. So he asked me, "Have you taken history?" I said, "Yes." So please go ahead. So I started presenting the history. In the meantime, that senior resident came rushing, said, "Sir, remember it was 1983. So only one CT scan in the whole country, which was in AIIMS." And he came rushing, said, "Sir, I have arranged CT scan for this patient. So can I send this patient? They are calling immediately." So I said, "CT scan for what?" So he said, "No, I'm suspecting brain abscess in this patient, so I want a CT scan." So confidently, Dr. Ahuja said, "There is no brain abscess." I can tell you that because by that time, I remember I had given him history. It was a history of TIA and then followed by stroke. So I can now understand how confidently he said, "There is no brain abscess, no need to do CT scan." And remember, CT scan was not done routinely for all stroke patients those days. It was only when there was some indication that it used to be done. So it was a mild stroke, relatively mild. So very rightly, now I can see that he said no need for CT scan. And he could be also sure of ischemic because there was history of TIA. So it impressed me a lot because how can so confidently Dr. Ahuja was saying that there is no abscess and there is no need for CT scan. And then, of course, during the posting, I found that a lot of things, and this is different from many other specialty, that so much you can derive from history and examination, mostly from history. We often say that 80% of the diagnosis is from history and 15% from examination, 5% is added by or changed by the investigation. So the history was so powerful in neurology that it impressed me. And as I told you in the beginning, it appeared very logical, mathematical. So I chose to join neurology only because of it.
Sir, because of your interest in maths and because neurology was mathematical,
Yes.
it led you there. But you actually did something more mathematical than that, which was your training in epidemiology and biostats. So, what drove you there, and how did you get that opportunity, and what were the new learnings that happened, and how did it embellish your neurology career?
Yes. I must thank the visionaries of All India Institute of Medical Sciences. They selected some clinicians from cardiology, neurology, medicine, surgery, and of course, community medicine and pediatrics to go to places in US, Canada, Australia to learn what they call clinical epidemiology, still called clinical epidemiology. Basically, I went to McMaster University, Canada, and this was in 1992. So I had already been faculty members for 6 years. So I chose to go there because of things which I experienced during my MD. My guide was Dr. Pandey in MD, and of course, chief guide was Dr. Valeria, senior Dr. Valeria. And I found that Dr. Pandey went for training in the same, program. Before the training, he was guiding me one way. After the training, when he came, he changed completely. So he was asking questions which he never used to ask earlier. And in fact, scrapped everything which had been done till that time, and he changed my thesis completely. So I thought, what has happened to him? And then I learned that for 1 year he went for training in clinical epidemiology, and that is what made such a big change in the way he approached the whole thesis. So I said I must learn this, and I, in fact, approached the head of the Department of Community Medicine who was running this program. And I said, I'm interested. I went to McMaster. I must say that McMaster training changed my academic life completely. So I would say I was a very well trained clinician, and I'm proud of my training in AIIMS, both in medicine and neurology. But after training in McMaster, I became what they call clinician scientist. So uh, even US is struggling to maintain the number of clinician scientists. And in India, there were very few. So uh, it changed the way I used to write research proposals, research papers, do analysis. We learned all the statistical analysis which are required for a clinician, not deep into statistics, but at least the usual analysis. We learned about research methodology. There was also training in medical education and quality improvement in healthcare. So that was a very well-grounded training, which I wish everyone has a chance. And from that only, I proposed your name for training in clinical epidemiology because you were interested, and I thought it will contribute immensely to your career progress. All of us, and who got training under this program, it completely changed our approach, both to our patients, to our research, to our teaching, and even to in our everyday life. And some of that I can tell you if time permits, but let's go through our journey first, then we'll come back to it.
That is correct, sir, because in your own way, you have also, in a way, of course, you've mentored me, but you have also put in a lot of effort to start the fellowship program in research methodology and evidence-based medicine at AIIMS, which is still at its initial step. But I think that is something, the importance of which I only realized once I came back from my own training, that it is such a vital part of especially clinicians who are in academics. They need to know, because whatever research we are producing here is going to be regarded and complied by the policymakers as well as the clinicians at large, and it has such a large impact. So we have to do it very meticulously. Sir, you also went to Bahrain. So how was it academically? What academic experience did you have there?
Yeah, so again, it started from McMaster because I had learned systematic review and meta-analysis and conducted some Cochrane reviews. And I must tell you, I may not be wrong if I was the first person from India to publish a Cochrane review. But that was because Dr. Warlow invited me to join a Cochrane review group in 1993. So after I was attending evidence-based medicine workshop in Muscat, if I remember correctly, and the dean of Bahrain was there. So after he saw my teaching, and he said, "Why don't you come to Bahrain?" So there's a long story. I was very scared of going there, but then after 1-day visit, then 1-month visit, then 3-month visit, I decided to go for longer time. It's a good place, but people think that if you go to countries like Bahrain, Gulf countries, it is only to make money. But that is absolutely wrong, in my case at least, because Dean of Bahrain is an educationist. He did PhD in medical education while I was there, and I learned a lot of things about medical education from him. And what he did was he started Masters of Science in Health Profession Education in university where he was dean, and invited top people from around the world who are in medical education, from Netherlands, from USA, from Canada, all the top people who have worked in medical education throughout their field. They came to Bahrain to teach in that master's course. where I was also a faculty. So more as a student, I attended their, they used to spend 1 week. The whole 1 week I will spend there and learn a lot of things from them. So all I initiation was in McMaster University, but when it is a problem-based school in McMaster, problem-based medical school in Bahrain. So I really learned about problem-based learning, about educational research methods, about all the technology and jargons which goes into medical education, like Miller's pyramid, Bloom's taxonomy, and Dreyfus model, and all these things which are, you can say, inspiring the competency-based medical education around the world today. So that was a big contribution of, I would say, the Gulf University in Bahrain as regards my own perspective.
So how did this training help you in choosing your areas of interest in neurology itself?
Right. So when I was in McMaster, you have to write a lot of what they call end of a course assignment, and then you have to write a thesis. So end of one course assignment, I wrote a paper in bacterial meningitis, which is also a meta-analysis published in 1995, I think. And the second one I wrote was a randomized controlled trial proposal as an assignment in TB meningitis. That was dexamethasone trial. So having done this, and then there were some small assignments in medical education and economic analysis and so on. But the big thesis which I had to write, which was on role of surgery in intracerebral hemorrhage, which included a meta-analysis as well as a randomized trial proposal. That is, so you can see when I was working in McMaster, I was keeping in mind that India is facing the dual burden of communicable and non-communicable diseases, and we have to deal with both simultaneously. So I chose some in the meningitis field, bacterial and tubercular, and major thesis in stroke. So this was already going through my mind before I went to McMaster, but it crystallized there, and then I continued in the same vein when I returned. And as it happens, because stroke went on increasing both as national burden, and also it required a lot of, you can say, inputs in the form of developing protocols, national guidelines, even development of the national program of involving, stroke, diabetes, and cardiovascular diseases was something where I was privileged to be involved from the very beginning. I think from 1996 or 95, 96, we started to work on that, which culminated into a national program. Now, as we know, NPCDCS, National Program for Control of Cardiovascular Diseases, Diabetes, Stroke, and now cancer is also included in that.
So you were the convener of the stroke national guidelines. So how much of your effort, time, and how did it enrich you in your experience?
Right.
What was your experience?
So when actually Indian Academy of Neurology and the Indian Stroke Association had already published a guideline in 2010, which was released from Indian Stroke Association conference in Delhi, which was actually conducted or organized by us in AIIMS New Delhi. But there was lacunae because of, again, training in McMaster. We knew that you have to evaluate the quality of evidence and strength of recommendation whenever you write a guideline, evidence-based guideline. And this was not possible in the short time which was given to us from Indian Academy of Neurology and Indian Stroke Association. And my other member colleagues, they said, it will take time for us to come on board. You have the training in clinical epidemiology, we don't have. So let us have the usual guideline, then we can do better job later on. In the meantime, government also approached, and since I was in AIIMS that time heading the department, they said, why don't you convene a group to form a national guideline? So, of course, you know, in India, if you become a convener, it becomes 80% your burden to see that things go through. So I literally landed up writing almost 3/4 of the guidelines, and there were, of course, contributions from each one of the member. And then we finally got approval from the government, and it is on the website of uh, Government of India, Department of Health and Family Welfare. But I must say that we still have to apply formally grade methodology to this guideline. There are certain things which we need to bring up to date because now, you know, mechanical thrombectomy has a lot of evidence, and this is something which should be like a living guideline. What WHO and other people think, living guideline keeps changing as evidence goes on emerging. That is what we have to make it to, from what is now available to convert into living guideline. And fortunately, as you see now, my training in McMaster has made me confident in applying the most up-to-date methodology for forming evidence-based guidelines. In fact, I remember somebody in Canada saying, you know, when I was studying clinical epidemiology, I didn't know whether it will help me. But when I started doing technology assessment and clinical practice guidelines formulation, then I saw why it is important to learn clinical epidemiology. So that is what I also felt, that not only in your research, but when you are making clinical practice guidelines, you have to bring in knowledge of clinical epidemiology or research methodology. Similarly, when you are doing technology assessment, any technology which comes, whether it is educational technology or patient care technology or diagnostic technology, you have to bring in knowledge of research methodology and clinical epidemiology, evidence-based medicine, to finally decide whether to use this technology or not. And that is why evidence-based medicine became very, you can say, my mission. And I think every doctor has to at least be able to read what is the strength of or quality of evidence, and what is the strength of recommendation, and what does it mean. Otherwise, people prescribe a lot of medicines which unfortunately our poor patients are paying for, and they are really practically useless, and maybe worse than placebo because they may harm. So to save your patients from unnecessary harmful medication, unnecessary tests, to keep the doctors up to date through what is called lifelong learning, and also to direct the limited resources we have to something which is useful and you can say helpful for the patients, is what evidence-based medicine is trying to achieve. And it has all emerged from clinical epidemiology. And those who will know the history of evidence-based medicine will learn that clinical epidemiology department in McMaster University, where we went for training, is the mother of evidence-based medicine or evidence-based practice.
I can't agree more, sir, because I think the training in our journal clubs is way different from what we were doing in our MD days, of course, but also within all departments of AIIMS, because you had been in the department and supervising and attending actively a lot of our journal clubs, and also criticizing the lacunae which as students we were not even aware of, has shaped our thinking, has shaped our rationale in a very different way from what we see from the clinicians who take evidence on face value and don't critique it or don't look at it from different perspectives. So I think that is something which is very underrated, and I think it is something which is very exclusive to the training that we receive here at AIIMS New Delhi. Now I think we can shift gears, and I would like to share some of the photographs which are there from my residency days, and uh, they give an insight of how Sir was not only very actively a part of the academics, but also he used to be a very a consistent participant and an active participant when it came to farewells and fresher parties. So this is, I think, when I had recently joined as a faculty in 2012. So this was, I think, somewhere in Deer Park, where I think Dr. Bihari was the HOD at that time. And so Sir has been very active, and he also was very instrumental in holding the first AIIMS alumni meet. Sir, would you like to say something on that? Because I think that was something very
that's
close
right.
to your heart.
Two things which I am very proud of initiating. One is the alumni meet. An alumni meet is both for the purpose of meeting each other. It is also for the purpose of continuing our, you can say, association. But also I want them to get involved in what AIIMS is doing. So as you will recall, I always involved, of course, others, but also our students who are our former students who are now heading departments in all the research which multi-centric research which we carried out. So that is one thing I'm very proud of. The second thing which I started was AIIMS PGI annual neurology update. And that is, I'm glad the COVID had a little bit of setbacks, but it is continuing and will perhaps continue hopefully for all the time to come. And that was done what we call totally in a contributory way, because faculty contributed their conference visits, no charges from the organizers, and those participants, they contributed for their own meals and reading materials. So there was no funding required from any source except free hall which was provided by our institute. So I often say that good academic program is possible if people just contribute minimally and make it successful. And that AIIMS PGI neurology update is one example of that.
Exactly, sir. So that is one example which is still running in full force. Even despite COVID, we had it virtual, and hopefully this year we'll have it physical as well. I think one thing which all the young neurologists who are listening to this particular conversation with you would like to know is if any message that you would want them to be instilled or to be remembered very strongly, what would you tell them?
Well, I think there are few things which one might like to take from this. One is that always take up challenges, right? And that will give you some learning. So, for example, I was of course, we had a little bit of training in McMaster about quality improvement in healthcare, but World Bank asked me to lead a team of AIIMS clinicians to help them in quality assurance in healthcare in their project, which was going on in many states called State Health System Development Project. So I formed a group there. I had less or little idea about quality improvement, but in that, we were able to again invite people who had spent whole life in quality improvement in healthcare from Netherlands, from Australia, from US, and we learned a lot. So that was a challenge given from World Bank, which I took and had a lot of learning. Similarly, I told you the challenge was given from Department of Health to make the guideline. We took it, learned a lot. A challenge was given, I remember, by Secretary of Department of Biotechnology, who happened to be earlier Professor of AIIMS, Dr. Ban. Can you write a protocol within 2 weeks? We want a stem cell study in stroke, multicentric in India. It was a challenge. We took it, did it, and finally successfully completed the study and published, which is one of the most cited paper I have. So any challenge given to you, take it, small or big. Small challenge like, can you give a lecture? Like they will say, can you give a talk in this debate? And they may place you on the other side. I remember Dr. Mehendi Rata placing me against evidence-based medicine in one of the debates. I said, well, if this is a challenge, then we will do it. We might as well do it. So take a challenge, even if it is a lecture, take it up and do it. There will be a lot of learning. And don't be afraid of your Hindi medium background or rural background or poor background or whatever it is. I think if you work hard, things will fall in place and you will succeed.
Thank you, sir. So that was very enlightening. And I think we learn a lot from your endurance, your perseverance, your discipline, your assertiveness. And I think that is one thing which not only young neurologists, but probably young academic faculty in neurology at various places also need to imbibe or emulate, that the values or the standards which were set by the senior faculty members at premium medical institutes also need to be nurtured, and the same discipline and camaraderie needs to be followed. So thank you, sir.
One thing you might like to know that I took advantage of the captive audience of neurology department in continuing my singing skills. And you have been one of the captive audience, I guess.
Yes, yes. So I think I would like to share one last picture from the slideshow or the limited, bank of pictures that I have. Is that sir is a very good singer, and I think in a lot of farewell parties and meetings, informal meetings, he was somebody who not only used to sing himself very melodiously, but also used to motivate a lot of other singers of the department to bring their musical instruments and also to sing along. Dr. Rohit being one who used to bring his guitar at such meetings, and it was a very good experience also for the students, because that was a fresh perspective of their teachers, whom they used to see very grim and sober all the time. So I think that is also one thing which is slowly dwindling, because the students have their own shell or their own socialization, and the faculty have their own, and there has to be a place where both of them should mingle and also share their common thoughts and opinions, which makes the environment very, very informal and also very receptive. So sir, as we know that you have had an exemplary research record, and there has been so much that we have learned from your research experience. What would you like to convey to the as neurology aspirants, how to pursue research with good clinical practice?
Right. First of all, I must say that in the beginning, you have to make a decision about research. What I did was, and maybe it is my tendency to always take the difficult path. So I decided for myself that I will take funding only from government institution and no research funded by industry. I just wanted to set an example that with government funding alone, it is possible to conduct good amount as well as good quality of research. And that was my own decision, and I continued it throughout. And today, if you ask me, do I regret? My answer is no. I have done more research than I could have done otherwise. And in my innings in AIIMS, the then director told me that the fund which we got for AIIMS cohort study, which we call Lokarpan now, was the biggest fund which was ever received by AIIMS on any extramural research. So that decision didn't actually put me in disadvantage in any way, if not in advantage. The second principle which I sort of decided for myself and which I would like youngsters to follow is once established, and I had to do research because of course we get tuned to doing it. I wanted to do something which brings my country on focus from around the world. So either we participate with the rest of the world or we do something which is first in the world. So I'll give you some example. There was so much hype about stem cell, and we conducted within the country stem cell research, which was based on bone marrow mononuclear stem cell, and that was in 5 centers in the country. And we really established something which has not been disproved even till date. In fact, a paper came later on, maybe many papers which have cited our papers, and our findings have stood the test of time. And that is where I would also like to say that we reported a negative finding, which was not something which people like to see or editors like to publish. But once it has been published, we think we did the right thing, and we did it to show that if you do research in which you have honesty of purpose and publish whatever you get, and we published in a good journal, Stroke, which is American Heart Association journal, everybody knows, then people will appreciate it. And that is one principle. Similarly, I said, nobody has done a cohort study like Framingham and Rotterdam, and you know it, we started it. It was a big challenge, and I must say that almost 10 years of my life was dedicated to doing this. Finally, we got it, at least baseline was completed before COVID started and actually disoriented this, our plan. But in any case, we established, we published, and this is first study in India where brain MRI and genetics and all the neurological, cognitive, and cardiovascular parameters have been assessed for the first time. That also brings our country one of those where there is cohort study of this kind in the lines of Framingham and Rotterdam. So similarly, another study we did, which was genome-wide association study, first time from India in the field of stroke. That also we published in Neurology USA journal. Again, it brings us on board with the rest of the world because many countries have published it. And I used to feel bad when in conferences, India was not figuring anywhere in genome-wide association studies in stroke. So in the later part of one's life, one should take up studies which will bring the country on the world map, and will be something which will be maybe first of its kind, if not in the whole world, at least within the country, not only to replicate what others have done, but something which will help us, because our genetics is different from genetics of Caucasians. We don't need any research for this, and we have got to do our own genetic study. We can't copy from US or UK or any other Caucasian population. And that is being shown in our papers also. We have got some gene which predominates in India or South Asia. And only yesterday, or today, Nature is publishing one of our, let's say, meta-analysis where we have participated, led by a French group. And it shows that South Asians, where we have put almost 5,000, 4,000 few hundred subjects, we have a different gene. And that kind of thing has to be done in the later part of life, when you have established as a researcher, and you don't necessarily have to do this with industry support. You can do it with government support or government funding agency support. But yes, it is difficult. It is a difficult path, but I have taken that decision for myself, right or wrong, that I will choose the difficult path. And fortunately, I had some successes and no regrets.
So that was very inspirational, because it also gives that apart from ethics, apart from accomplishing things, the ethics for accomplishment. So the motive should be good and high, but the path to that motive should also be very ethical, and that is very important.
Yeah, as they call it, that means towards the end is
Yes.
as important as the end itself.
Exactly, sir. So regarding your achievements, because we were talking about them, what would you list as your most significant or maybe your dearest achievement?
Well, I would say that if you list, let's say, things which have been recognized, then I would think recognition by peers is probably the something which one cherishes. At least I like the most. So, though I had several awards, but two certainly I feel are closest to my heart. One is the AIIMS Research Excellence Award, first prize, which I got for the stem cell study, which I was talking about. And the second, which was from McMaster University for what they call Educational Achievement Award. And that was based on feedback from the learners who participated in the group discussion, which we used to have. And there, you are with the same group for 4 hours every day, and for 4.5 days. So almost 5 days. So you are probably 20 hours with the same group. And most of the people have been from USA or Canada or some European countries, some from China, some from Japan. And the reason they gave me award was that every time successively, at least for maybe more than 10 years, they all gave the highest level of feedback, or let's say score, for my teaching, which was something which there is no money attached to this award. There is only, you can say, a piece of paper, but that is, I think, I like the most, because it is for my teaching, which is something which you love to do. And when students give you this recognition, I think that is the most important, at least from my perspective. So students and peers for research, students for teaching, if they give you something, I think that is the best recognition one can have. So of course, Oxford didn't have any feedback system, but I must say that teaching there, 3 years I went successively, was also a matter of, you can say, accomplishment for us, because coming out from a village and going and teaching successively for 3 years in Oxford, I would have gone further, but UK government changed some rules. They were not allowed to give me airfare and other things, because we are not in the list of countries where they can give this type of facility. So, but 3 times going there and teaching, that was again something which you feel a sense of accomplishment. And so I will say again, people who think they are from Hindi medium, they have started English in class 6, doesn't matter. You can go and teach in Oxford if you work hard and persevere, and perhaps come up and contribute, maybe dedicate yourself. I think anything is possible to achieve. Thank you. Thank you for giving this opportunity to share my experiences with the young colleagues. Thanks a lot.
And I would like to thank IAN for putting this up together, so that we can
Yes, I
share this.
also
Yeah.
thank IN for doing this. This is a great effort. Thanks to our president, Dr. Surya, who has started this.